Hello, everybody. Dr. F. Scott Field here, and I'd like to introduce you to our newest sponsor. The NPTE Final Frontier is the review course that I wish was around when I took the board exam. For those of you who know my story, it took me a handful of times to pass that exam, and quite frankly, I really wish I had an exam review course around, just like the NPTE Final Frontier. Check out their website, npteff.com, and use the code HET at checkout for 10% off to all of our listeners and fans.
Hello, everyone, and welcome to another episode of the Healthcare Education Transformation Podcast. I am your host, Dr. Dawn Brown, and I am bringing you another Teach Me Something Tuesday. Today, we are going to talk about recognizing soft skills as essential skills. There's a misconception that skills in physical therapy are divided into two categories, hard and soft, with hard skills identified as the knowledge and skills needed to perform patient management, those skills that are practiced in your labs and during your clinical experiences, skills that you can essentially measure. While soft skills are considered personality skills, such as communication, empathy, and compassion and caring, which may be more difficult to measure. However, I challenge you to change your perception of these so-called soft skills, recognizing them as essential skills without which patient management cannot occur. You need to develop the ability to make meaningful connections with your patients so that rapport and trust are developed early in the patient-client management process. Without a foundation of empathy or compassion and caring, your skills as a physical therapy student do not matter. I remember having a patient who had a debilitating leg injury that threatened their career and caused the patient much stress and anxiety. Had I not shown genuine compassion for this patient, allowed them to express their frustration during the physical therapy sessions, despite the recovery process going in the right direction, the positive outcomes that were achieved by the conclusion of the physical therapy episode of care may not have been achieved without me using these essential skills. I would have treated the patient as a disease rather than a person, someone that I could just practice or use hard skills on. I know that many of your courses in your physical therapy program center on professionalism, and these are often those one-credit courses that you tend to blow off. Change your mindset and perception of these courses. These essential skills are in part shaped by your lived experiences, how you're socialized, and your sociocultural identities. But physical therapy program courses can develop these essential skills toward achieving optimal patient care. So I challenge professors in physical therapy programs to change how they introduce these courses to their students. Emphasize them as essential courses that are the foundation of everything we do as physical therapists. Maybe even consider making them 2 to 3 credits so that they are on par with other courses such as orthopedics or neurology or cardiopulmonary. As the late great poet and civil rights activist Maya Angelou stated, people will forget what you said, people will forget what you did, but people will never forget how you made them feel. Be that student physical therapist who will leave a lasting positive impact on your patients long after they've been empowered by you to manage their disease or condition. Take pride in using your essential skills. I hope that the information on recognizing soft skills as essential skills was helpful, and we will see you on the next Teach Me Something Tuesday.